Anyway, hi everybody. So, I'm going to try to get through this one. And in the grand tradition of the social sciences, who I've worked very closely with over these years, I'm going to start us with a joke because maybe that's what Jerry would want, right? A priest, a minister, and a rabbit walk into a bar. The rabbit says, I think there's been a typo. It's funnier when Michael Strayer says it. Before we get going on this quarter season series, I wanted to take a moment to talk about the history of community conversations. I'm a historian. This is what I do. Today's speaker has graciously offered to give me a couple of minutes before she gets started, so thank you to Jessica. Jerry Zimmerman taught law and humanities and social sciences here at LCC from 1976 until his retirement in 2012. He was beloved by LCC students and his fellow faculty. He was instrumental in creating an active integrated studies program at LCC, and he was a master of the multidisciplinary approach to education and at bringing people together across the disciplines. Fellow retiree and social science faculty member David Benson once called Jerry a Renaissance man, and I think that really, really suits him. After working with the Evergreen State College, Jerry brought the model of learning communities back to LCC, celebrating interdisciplinary work, collaborative teaching, and higher student retention. Now, I arrived at the college in 2007, and that's when I met Jerry. And in 2008, he founded the Community Conversations program and invited me to be an occasional guest speaker. That has changed my life in a lot of ways. Jerry passed away earlier this month, but 17 years after he created this program, we are continuing his legacy. And you're all part of that legacy too. Those who signed up for Humanities 106 and are taking it as a class, those who've chosen to be lifelong learners by attending our sessions, and those who just want to learn some new stuff. You know, maybe this is the particular one you wanted to know about. And I love this community, and I look forward to Thursdays as a chance where I get to learn something new. I get to see some familiar faces that I don't get to see very often, or some new faces that maybe I don't know, and I get to meet some new people, as well as seeing how a particular topic might spark people's interest and want to know more. Curiosity, learning. That's what this is all about. So thank you all for coming out to our session today. And thank you to Jerry Zimmerman for making it possible. We will always be grateful to the community you built. Thank you for giving me this moment. And now I'm going to introduce today's speaker. Jessica Kooiman has been working at Lower Columbia College for 19 years in a variety of roles and is now a tenured health and nutrition faculty in her 10th year at teaching within the field. She holds a master's in public health with a concentration in nutrition and plans to pursue a certification in intuitive eating counseling within the coming year. So please welcome Jessica Kooiman.
You. Thank you. Can you everyone hear me okay? Great, great. Thank you all for joining me today, especially on this day when you could be outside enjoying the beautiful weather. Hopefully you'll get a little bit of that this afternoon, but I'm glad you're here to talk about what I feel is a really important topic. We're going to be looking at the idea of weight neutral approaches to wellness, a discussion of health priorities and inclusivity. So again, my name is Jessica Kooiman. I love this college. I've been here for a long time, and I've seen some amazing things, amazing changes happen over the last 19 years, and I'm just really honored to work at this amazing place. All right, well, let's get started. I was wondering if this little guy was going to work, so that's okay. We'll try this one and see. No, okay, I'll hang out over here. No worries. Okay. Oh, let's see. Well, no, we're in the full screen and you went ahead and hit slideshow. There we go. I don't know. I just needed to tell it again. So I want to start out with some questions to ponder as we think about this topic. Okay. So do you think of yourself as a healthy person? Just take some internal thoughts. Internal thoughts. Do you think of yourself as a healthy person? What specifically about you makes you healthy or unhealthy? Do some internal thinking. What about you makes you healthy or unhealthy? What are some of your health goals? Are these goals that you have set for yourself? Or could they possibly have been influenced by societal expectations of health and what health is supposed to look like? Just consider that for a minute. And would you describe your goals as sustainable? So just be thinking about these questions as we talk through this concept of weight neutral approaches to wellness. And see if your answers maybe change. See if these are questions that you'll want to reconsider. See if these are questions that you'll want to ask others in your life, loved ones that you have. You might want to help them reconsider their answers after this conversation. Okay. So what if we prioritized health and well-being in all of its layered, multifaceted ways, rather than just focusing on weight, BMI, or body size? Could we then create a healthier, more sustainable approach to well-being for everyone, regardless of size? Something to think about. Why would we consider this strategy? It's been our healthcare strategy for so long in this country to be focused on weight and BMI as a major indicator of health, right? We have our BMI categories. Underweight. What's the next category called? It's called healthy weight. Then we've got overweight and obese. Okay, so we tie those numbers to health, and we've used those numbers for a long time as strong indicators of health. So why consider maybe changing it up when we've done things this way for so long? Well, weight neutral health strategies focus on overall health and well-being independent of weight or size. You've probably picked that up already to this point. And as a result, this reduces internalized weight stigma, which actually occurs in individuals in larger than normal and smaller than normal body sizes. It can occur with anyone. We're talking men and women. We're talking all different body sizes that are not in the normal category. And so it kind of takes your focus away from what is considered healthy and normal and tries to put the idea on overall health. So helps to bring down that internalized weight stigma of what is considered healthy, which then encourages a refocus on actual health outcomes. Actual health outcomes instead of arbitrary numbers. That this can then lead to short-term wins that keeps motivation going, right? So let me stop and talk about what actual health outcomes, what do we mean by that? Actual health outcomes. Maybe better mental health, maybe better sleep, maybe increased energy, maybe better connection with others, Maybe, can you think of some other ones? Maybe better blood pressure. Let's talk some different numbers. Maybe better glucose numbers. You can affect glucose numbers without reducing your weight or body size. You can affect your glucose numbers. How about better cholesterol numbers? Those things can be changed without a change in body size from health behaviors. Let's see, I've made a list here. Let me make sure I got all of them. More energy, better sleep, better stamina, better mental health, connection with others, improved blood pressure, improved glucose levels, improved cholesterol levels. These kinds of things are actual health outcomes, short-term wins that keep that motivation going, rather than these kind of arbitrary numbers that can be difficult for a lot of people to achieve because not everyone's body is meant to achieve these arbitrary numbers. And when I say arbitrary numbers, I'm talking about weight and BMI, which is kind of where we've been focused for a while in healthcare. I think because they're easy to track, right? They're easier to track. And so when we're trying to do population studies and things like that, it is easier to track those kinds of things. But, more and more studies are really showing that, weight is really nuanced. Weight is very nuanced. We've got a lot of genetic components that come into play as to how does anybody know what BMR stands for? Does anybody know what that is? Say that again. Okay, so you're thinking of BMI, and I'm looking at BMR, basal metabolic rate. So this is your metabolism. Yes, okay. Your basal metabolic rate is the biggest part of your metabolism, right? What burns the most calories, and that is tied to your genetics. And so there are people who have naturally very thrifty metabolisms, right? And very quick metabolisms. So that's going to be a lot that, there's a lot that goes into the genetics of weight. And then when we look at BMI, what are the two things that are used to determine a BMI category? Height and weight. Height and weight. And I think we've known for a long time that, BMI does not take into account muscle mass. And we've known for a while that that is a problem, right? But it also doesn't take into account differences across race and ethnic groups, sexes, genders, and age span. There's a lot that differs between all those categories. And so BMI can really cause some issues here if we're looking at that to indicate health. And in fact, back in June of 2023, delegates at the annual meeting of the American Medical Association adopted a policy educating physicians on the issues of focusing solely on the use of BMI. So it's starting to shift. It's starting to shift. They were encouraged to start looking at health behaviors alongside the numbers that they were seeing as far as weight and BMI. Okay, so sorry, I could go on and on and on about this, but we need to keep going. So weight neutral health strategies also result in positive psychological effects, leading to improved self-esteem, body image, and overall mental health. Some more reasons to consider this strategy. This strategy reduces the risk of developing eating disorders, because for a lot of people to reach the numbers that are considered healthy, they have to go on very restrictive diets and do excessive exercise because their body may not be naturally inclined to be at that particular size or at that particular weight. And so in order for them to get to that particular size or weight that is considered healthy, they have to go on very restrictive diets. and very excessive exercise routines that unfortunately are not sustainable for them and can then encourage the development of eating disorders. Instead, weight neutral health strategies promote a healthy relationship with food and activity. Weight neutral health strategies lead to these sustainable life changes, focused on achievable goals. These result in these health improvements, which are sometimes independent of weight loss or change in body size and shape. Sometimes there is a change in body size or shape, but there may not be. And it also aids in avoiding the negative physical and mental health effects of weight cycling. So let's say someone was able to do this restrictive dieting, excessive exercise to get to that number that they were told is the healthy number they need to be at. And then their body's like, this is not working well for me, right? I need my carbs back. And so they start to eat the carbs again, or whatever it is they were restricting, and their body gets back up to where it was before. And then they're feeling terrible about themselves. And so they go back on this restrictive diet to get back down to that healthy number. And it is this weight cycling that's happening that is very difficult on their physical and mental health. And so trying to avoid that cyclical pattern that can be very detrimental to mental and physical health. And the last reason to consider this strategy is helping to avoid situations like this one. I had a student last year share with me a situation that arose at her place of work. So this is coming from her perspective. I was standing at my desk preparing for the next patient and answering patient advice requests. It was a cold winter day, and I was ruminating over the conversation about my favorite hikes I had just had. Sorry about the mic. I think I'm a little close to it. I was ruminating over the conversation about my favorite hikes I had just had while checking in my last patient. She, like me, was in her early 40s, working and raising a family and lamenting the changes occurring in her body. We talked about the frustrations of that and how thankful we were that we could still get outside and hike, even if we were slower and it took longer to recover. When I left the room, we were both laughing and smiling and looking forward to spring waterfall hikes. And then, in the course of 20 minutes, everything changed. I noted that she was tearful and looked defeated when I returned with her discharge instructions after she visited with the doctor. I immediately sat down and asked what was up, and she told me that the doctor had spent the whole visit talking about her BMI and how she needed to lose weight. She had even called her fat and said that was the reason for the issue she had come in for. I was horrified because I had reviewed her labs, which were all good. And while yes, her BMI stated that she was obese, I also knew from her intake questionnaire that she was active and going to the gym 3 days a week. So here is a situation where her labs were good. She's an active person. She's obviously, got some hormonal things going on. She's in her 40s. And the doctor was just very fixated on the fact that she was now in the obese category. So we can look at this situation and we can think, oh my gosh, that's terrible. We would never treat someone like this. We would never have these assumptions, right? We would never have these assumptions about someone. And yet I want us to encourage ourselves to all consider our own weight biases, because we all have them. When we look at a small person, we look at a large person, we look at a normal weight person, whatever you want to call normal. We look at a person, small, medium, large. We make assumptions, right? We make assumptions. And with those assumptions, we make judgments. We often keep those assumptions and those judgments to ourselves. but we make assumptions and we make judgments, and we all have them. We all have biases. So I would encourage us to kind of check in on the biases that we have around weight, around fit versus not fit. When it comes to hiring people, when it comes to making friends, when it comes to who we hang out with, it's just kind of interesting how those little biases can take spots in our brains. Weight bias can lead to weight stigma. Weight stigma does tend to affect people in larger bodies more than other sizes because weight stigma can keep individuals from seeking healthcare as they are concerned that the focus of their appointment will ultimately turn to their weight, regardless of why they sought out care. Listen while I read you a story of a woman from Seattle. This was an NPR article from December 2023. About 5 years ago, Sarah Barak badly tore a ligament in her thumb and needed surgery to get it reattached. But when she went in for the operation, she got some unsolicited advice. The surgeon said she should lose weight, suggesting that her size and her injured thumb were connected. He was making the argument that my posture was affecting my arm pain and that my posture was made worse by my size, all of which could be true, Barak says, but I still had a disconnected thumb, and even if I lost 100 pounds, the thumb would not have been reattached on its own. Barak says, she's assertive about advocating for the care she needs, but it's draining. It's freaking exhausting, she says, and frankly, not everyone can do it. For years, weight has been used as a measure of health in doctor's offices. Having a higher body mass index, that's the BMI, has been correlated with heart disease, diabetes, certain types of cancer, and other conditions. But in recent years, research has shown that when clinicians focus on weight, it can lead patients to avoid or delay healthcare, including recommended cancer screenings. People with larger bodies often report that when they go to the doctor, their problems are ignored or written off as an inevitable result of their weight. Without asking questions, they say, healthcare providers suggest diets they've already tried or lifestyle changes that they've already made. Providers sometimes miss major health problems in both people with larger bodies and those with smaller ones when they're too laser focused on a patient's weight, says Dr. Lisa Erlinger, who practices weight neutral medicine and is a clinical professor at the University of Washington Medicine in Seattle. There's so many horrible stories of diagnoses that were missed because the focus was on weight, she says. The evidence that focusing solely on weight can harm patients has led some in healthcare to examine their approach. In June, the American Medical Association, so this is what I told you about a few slides ago, stated recommending the clinicians look beyond body mass index to understand a patient's health. But a growing number of providers are going further than that, practicing what they call weight inclusivity or weight neutral care. Some subscribe to a set of principles called health at every size. In most cases, the care that you're providing should be the same no matter what the number on the scale is, says Tess Moore, a family medicine physician in Seattle, who has made her practice weight neutral. Moore started by trying to make her clinic feel comfortable for patients of all sizes. Every exam room has an array of blood pressure cuffs for different size arms, as well as gowns and speculums of various sizes. The chairs and exam tables fit all patients. But it's Moore's approach to talking about weight that's most different from a more traditional practice. We don't recommend weight loss as a way of treating medical conditions, Moore says. Instead, she tells her patients that exercise and nutritious food are good for them regardless of whether or not they lose weight. We recommend moving your body in a way that's sustainable, which hopefully is joyful, she says, and eating food in a way that nourishes. Moore says that emphasizing the inherent benefits of exercise can help people start as well as stick with a routine. She points to research showing that even well-meaning comments about weight from family members and doctors can increase exercise avoidance, and that people with more internalized anti-fat attitudes are more likely to avoid exercise when they experience weight stigma. So, interesting. Thank you. I know that was kind of a long article, but I felt like it was important to share this woman's experience and some changes that are happening in the Seattle area around this topic of weight neutral care. So where do we go from here? Where do we go from here? What can we do to encourage a more open-minded approach to health and wellness? Well, for one thing, we can focus on giving non-weight related compliments, which is kind of an unusual thought, right? We're very focused on saying to people, wow, you look great. You look like you've trimmed down a bit, or things like that, right? It's just kind of part of our cultural way of being kind to each other. But we don't know necessarily the background of how or why that person has lost weight, or if it's something we want to encourage them to continue in, right? So we can look for ways to compliment people that don't have to do with their weight. Lots of ways to compliment people. What are some other ways you could compliment people? Their clothing, sure. If you wanted to continue to focus outwardly, absolutely. Their hairstyle, their clothing, their accomplishments. Yeah. Things about their personality, their smile. Yeah, so many things. Yeah. But I think we're really kind of used to giving those weight-related compliments. So just kind of shifting away from that is a good start. Encouraging the next generation to focus on non-weight measures of health. You know, it's very prevalent in our social media to be very focused on body size and shape and weight and all of that. It's what perpetuates the issues we have with eating disorders. So, you know, really trying to encourage the next generation to focus on those health outcomes of being healthy and happy that don't have to do with those numbers or the scale. And leading by example by following weight neutral approaches to wellness in our own lives. And that's where we're going to head next in this conversation. I'm going to give you 5 weight neutral approaches to wellness that you can consider adopting in your own life. Okay. First one, promote a positive relationship with food. Now, this is probably a full presentation in itself. And I am very excited that I'm going to be doing some more study around the concept of intuitive eating. But in the meantime, we have an amazing organization in town called Hello Life that is a nonprofit that does some free book groups on intuitive eating that you can join and learn more about this concept. But the idea is to reject the diet mentality, right? That we reject the diet mentality, we focus instead on intuitive eating, which is the idea of having this positive relationship with food. Now, before we talk a little bit more about intuitive eating, I found this gentleman, I thought his response to the anti-diet movement was pretty funny, so I wanted to share it with you. So let's see, and you'll have to excuse, he does have one bad word at the beginning.
Shit the bed, there's a lot to unpack here. The Washington Post basically calls out the anti-diet movement for promoting obesity. In a world where 500,000 Americans die each year from excess weight, how dare dietitians actively promote junk food? It sounds ludicrous, but it's not. For a long time, our industry has been extreme. So, you want to lose a few pounds? You need to cut out all sugar, carbs, sweeteners, gluten, dairy, soy, lectins, any foods with more than 3 ingredients, any foods that cavemen didn't eat, and any foods that bring even a hint of joy to your life. A lot of diets have been impossibly restrictive, causing a lot of people to jump from one crash diet to the next in a perpetual yo-yo dieting cycle. And this is a recognized problem. The anti-diet movement is kind of an antidote to this. Don't cut out foods you love. If you like cereal, then eat cereal, but in moderation. Focus on health rather than obsessing over the scale. Yes, invariably, some people do take it to an extreme, like implying there are zero health risks associated with higher body fat percentages. But every single dietary movement has extremists. I think our industry desperately needed to get away from here. And it is very easy to criticize people who are here. But it would be a real shame to let this deter you from finding your own happy medium, you know?
So I appreciated his take on that. So yes, encouraging intuitive eating. And again, we could talk a long time about intuitive eating, but these are the basics. Removing moral judgment around food. Yes, there are definitely foods that are going to fuel our body better than other foods, right? But looking at an apple and a donut morally the same way. Yes, the apple is going to provide more nourishment for us, absolutely. But taking away the moral judgment, it's a mental health kind of thing. So when we say, oh my gosh, the donut is evil, the donut is evil, and we cannot ever have the donut, what do we fixate on? The donut, right? So removing the moral judgment around food and making all foods equal is helping that positive relationship with food. Listening to our hunger and fullness cues, figuring out, when we've had enough, or honoring when we're hungry. We may have just eaten an hour ago and we say, well, I can't possibly be hungry, so I'm not going to eat because it's not time to eat. But your body may be hungry. Go and have a small snack, So listening to your hunger and fullness cues. Again, it goes so much deeper than this, but I'm hoping it will pique your interest so that maybe you'll want to learn more about intuitive eating. Find foods that fuel your body well, but that you also enjoy. Okay? Look at different colors. Try to eat the rainbow every day. I'm not necessarily referring to Skittles, although if you love Skittles, work them in moderation. But I'm talking about whole foods. Try to do some color, variety, but find ones that you enjoy. If you don't like spinach, don't force yourself to eat spinach, right? Find something else you enjoy. Looking to add rather than restrict. So, we're so focused on trying to pull foods out, like the guy was saying, like avoid this and this and this and this and this and this. Try to find places you can add whole foods that are going to benefit you, like whole grains, veggies, fruits, beans, nuts, and seeds. Look to add foods before you look to restrict foods. And then work on enjoying eating with others. These are some basics that promote a positive relationship with food. Weight neutral approach to health number 2. Engage in physical activity that you enjoy. You're going to see a theme here, about joyfulness, right? It shouldn't be this slog of excessiveness, right? Excessive dieting, excessive activity. It has to be sustainable. It has to be something you enjoy. Yes, there are recommendations for how many days, how many minutes you should be engaged in during a week. If that helps you to use those recommendations as a goal, then that's great. But if using that recommendation just feels like, it doesn't keep you motivated, then forget about the recommendation, right? Don't worry about working towards that goal or the number of steps on your watch. If that is something that is not helpful for you, then throw that out, right? And just find things that bring you joy. For some people, being outside is what is really going to bring them joy for being active, and especially now, this time of year. So, finding things that make you feel good. So taking notice of how your body feels during and after. If your body is not feeling good during and after, then maybe you need to pick a different activity. Focusing on increasing your strength, your flexibility, and your energy levels beyond just hitting, like I said, the number of minutes, the number of times a week, right? Look at the other goals that are part of this. Notice yourself getting stronger. Notice yourself getting more flexible. Notice your energy levels going up. Those are those short-term goals that you can meet that will keep you motivated. Listen to your body and rest when you need to rest. This is hard sometimes because especially if we have a certain goal for ourselves and we feel like, I'm really not going to meet my goal unless I get my workout in today, but I don't feel well, right? You've got to listen to your body or you're not going to be able to be sustainable in your plan. Find a space that feels comfortable and inviting. If you are part of a gym that doesn't feel comfortable and inviting, then find a different space. I have a complicated relationship with gyms, and I'm happy to share my story on a one-on-one basis with you afterwards if you'd like. But I have a complicated relationship with gyms, so I don't tend to work out in gyms. But some people really like gyms, and they really like that community that they find in gyms. And so that's a really inviting, comfortable place for them. Some people, they've got to be outside, and that's where they feel they've got a space. My basement is comfortable and inviting for me. I have made it a comfortable, inviting place for me. I enjoy going down to my basement. So you've got to find a place that feels comfortable and inviting. And consider making movement a social occasion, because it really can feed also that need for connection with others. I love it. There's a couple of employees, I think they're from the finance office, and they walk past my office 2 or 3 times a day. And they just say, this is what they do. They take their break and they walk and they talk. And it gives them that mental break, it gives them the physical break, and they get that connection. So consider making movement a social occasion. Weight neutral approach to health number 3. Sleep and stress management are important too. I've given you a couple links here. Courtney, I apologize, I meant to ask you ahead of time. Is there a way I can make slides available on the website? Okay, so I won't take time to open these now to watch our time, but these are both really good websites that give you practical advice on sleep management and stress management. It's got really good practical advice for making sure you're getting the sleep you need and also managing your stress, because those are really important parts of wellness. They can affect your blood pressure for sure, as well as other health indicators. Weight neutral approach to health number 4. Focus on non-weight health indicators: blood pressure, blood sugar level, and lipid levels. And like I had said earlier in the presentation, all of these can be positively affected through lifestyle change that may not necessarily result in a change in body weight or size. There may be a change in body weight or size, but there may not. And these health indicators can be positively affected through the lifestyle changes that we've talked about to this point. And the last one, respect that we are all different and give grace to yourself and others. Appreciate and respect your body for what it can do and avoid comparing yourself to others. Some individuals will find it most helpful to have a weight-focused approach to their health or need to engage in targeted weight loss for specific reasons. We need to honor their choice, but allow for weight-neutral approaches and encourage ourselves and others to consider those approaches. So there is definitely a movement right now that is weight-focused. And I have a number of friends that are focused on that, and that is a choice they've made with their doctor. So we need to understand that some will choose that, okay? But we need to also allow for these weight neutral approaches to be shared at the same time. As we look to weight neutral approaches in our own lives, don't try to change everything at once. Choose one or two things to focus on and give grace along the journey. And this is what will lead to sustainable health. I have a couple additional resources. The first one I would like to open and look at with you. And thanks to Sean Brown, who is here from Hello Life. Do you mind passing these out? Thank you. I will open it, and she's brought hard copies of this. This is a resource that she's put together that you are welcome to obviously print more of from my link. If it's helpful for you, I'm going to move this guy so I can. Okay. That you're welcome to use for yourself or pass on to someone else. But what this is something that you can use when evaluating your healthcare provider as a possible weight neutral environment, okay? So a guide for evaluating inclusive, respectful, and body affirming medical care provided by Hello Life Eating Disorder Recovery Services. So the office policies and environment. I will not read through all of them, but the first few have to do with mandatory weighing at the beginning of the appointment, and then allowing for there to be chairs and other things for all sizes. No weight-related jokes or comments happening. The second area is how the provider approaches the patient as far as talking through symptoms and goals. And then being trauma informed, the idea that the provider acknowledges the idea of weight stigma, that is a real thing that many people do experience, and how they respond to that. And then the bonus area, 3 things to consider. Do I leave appointments feeling empowered, not ashamed? Do I trust this provider to respect my goals and not impose their own based on weight? Would I recommend this office to someone in a larger body? So Sean and her staff have done an amazing job putting this together as a resource for those who would like to consider whether or not their healthcare provider does provide an environment where they feel safe in this way. Down at the bottom, if you do use my link, you will be able to link to the email as well as their website for more information on what Hello Life offers to the community. All of their services are free. Like I said, they do give some training on intuitive eating, but also eating disorder recovery as well. And the other resource that I've given here is just a link to the Amazon site that describes the intuitive eating book that was written by the two registered dietitians who began studying this concept years ago. So if you Google intuitive eating, you'll come up with lots and lots of information, but these are the people who started the whole thing. So if you really want to know what it truly is all about, this is your go-to, okay? And I think their book is like $11 or something. It's nothing extravagant. So if you're really interested in learning more about it, that's a place to go. And then there are my references. Can I answer any questions for you guys?
I'll come around. Ooh, hot
Great.
mic. And so we can pick up the questions on the recording.
Okay, perfect.
Yes, I think you said under levels, lipid levels, what is that?
So lipid levels would be like cholesterol. Yes. Yes. So like, yeah, looking at different cholesterol levels. Yeah, you're welcome.
I was wondering why they don't start this in medical schools to teach the new doctors not to focus on weight.
Yeah. Well, I think things are shifting. I think the focus is shifting. And there is a shift within medical school. I do know that there's more focus on learning nutrition within medical school as well, and preventative things in medical school.
And they should not talk about it unless the patient brings it up
Yeah.
themselves. Because if they want to talk about it, they will.
Yeah. Yeah, I would agree with that as well. But I think some physicians feel that, just from a well-meaning place, they want to do what they feel is best for their patient, and they feel like this could be a risk factor for them. So that's why they bring it
My
up.
doctor has never mentioned it.
That's good. Yeah.
Okay. Do we have any other questions?
Not a question. I just want to congratulate you for everything you say is simply common sense. A happy medium. I mean, you don't have to go to an excess of this side or that or whatever.
Yeah. Thank you.
This is just a detail, but on the third item down, trauma informed, I don't know what HAES is.
Okay, thank you. So that is, HAES stands for Health at Every Size. So yes, it is. It is a movement around the idea of weight neutrality. Yes.
Thank you very much to all of you for coming today, and to thank you to Jessica for your presentation. And please join us again next week. I have flyers at the back, which have our schedule on there. And of course, lowercolumbia.edu/conversations has the Zoom links and a description of what each event is about. So please pick those up on your way out. Ooh, do we have one more?
Thank you very much.
Just one more comment about our friend Jerry.
Yeah.
Many of us here miss him. And as one who had lunch with him occasionally, I'll miss that.
Yeah.
And I think that what he helped with a few others to start these kinds of conversations, even though there are not great membership to come. It was a foresight that he saw with actually, I would say about 3 or 4 others that said, let's do this and just see what happens.
Yeah.
These very small groups happen, but many of us who come go away with something.
Yeah.
Him and his friends who did it, and people like you who are willing to come and talk. And I thank you.
I can't ignore that. It's clear that there's a problem. It needs to bring it up. So I'm not overweight, so